I didn't even think I was scared to try. I didn't think I could do it. So yeah, that's the first I'd walked. So that was a good feeling. Oh, it's tremendous. I didn't think I could do it. Then the pain had gradually in the last few years gotten worse. It had gone down into the hip and into my right leg real bad. It was a burning, cramping pain and there was nothing I could do to get any relief. It just hurt so bad. And went on and on, you know, till, I mean, it was just terrible.
You know, most of the people that we're talking about treating are really quite debilitated by this pain. This isn't a little ache that comes and goes that really you can manage other ways. So the people that we end up recommending treatment for like this really have severe pain that is with them most of the time, that really interferes with their ability to sit, stand, walk, be active, and it seems to be a lot more common than we previously thought.
There was no way to get relief. You would think you could lay down and you'd lay there for maybe 15 minutes and that hurt, you get up, there was no relief, you know, and you just, yeah, you get really desperate for help. I mean, it hurts a lot.
So the sacroiliac joint, as you can see, is this long line here is the joint where these bones meet. So we make a small incision just a few inches long, and then really we're splitting the tissues, so without having to cut through much. We're coming through the ilium and into that sacrum, so that these implants end up spanning that joint within the bone, and a number of them, say 3 in a row, like this across that joint. Minimally invasive surgery and all aspects of surgery have been increasing and advancing over the last few years, and this is one of those procedures that took a very invasive, difficult surgery and made it a much shorter surgery with lower blood loss, with lower infection rates, with quicker recovery times, you know, less pain with the procedure itself. So this really changes things quite a bit. In actuality, the procedure itself, which should take no more than about an hour with minimal blood loss, is something that could be done just as an outpatient. But at this point, especially with a newer procedure, we're wanting to be very careful and monitor people. But would typically expect them to just be in the hospital overnight, and then there's some limited activities that we'll want them to put up with really for the next few weeks. Your incision healed up okay?
Yes, it healed up real well, and yeah, I don't really have any complaints.
Well, it really is exciting because this is a diagnosis, again, that isn't new. It's just that we, for many years, didn't have good treatments to offer. So this is really exciting that we have something that can be very successful and without the huge morbidity or huge side effect of some of the prior surgeries.
Oh, I love to walk. I love to do yard work. You know, my husband and I hike, camp. I'm a very outdoors person. I'm very active in whatever I do, and I have been limited to that. I haven't done much of that for the last several years because the pain was too tremendous. So I'm just looking just really to get my life back and be myself again, and that's a lot.